Hi, today I want to talk to you about scoliosis. Every once in a while I'll come across a person or a patient and they have the misconception that chiropractic care may not be able to help with scoliosis. And that's not really true. So there have been several cases in my practice career that we've not only helped with scoliosis, but sometimes we've even totally fixed it. And so what is scoliosis? Well, scoliosis is an abnormal curve of the spine. So the spine should go straight up and down, but if the spine starts to curve in this abnormal direction, and if it curves over 10 degrees, now it's considered a scoliosis. Well, chiropractic care is one of the safest and best treatment plans for scoliosis. So if somebody does have scoliosis, when they come in, we do a consultation, we do an exam, we take x-rays of the spine. We want to know exactly where the abnormal curves are. Because if we don't know exactly where the abnormal curves are, then we're not going to know where to fix. So we do the x-rays, we find out the exact abnormal curve, then we start to adjust the spine, and we may do certain types of exercises or rehabs in the clinic, which may help to correct it over time. And so recently I've had a couple different cases that I want to share with you. One was a young gentleman about 15 years old. He had a 17-degree scoliosis. And we took his scoliosis from 17 degrees in the lower back down to 7 degrees. So technically it's not even considered a scoliosis anymore. Another gentleman, actually was a younger guy, he was only 10, he had a 17-degree scoliosis as well, but we improved it from 17 degrees down to 2 degrees. You can barely even see that there's an abnormal curve at this point. And so can chiropractic care help with scoliosis? Yeah, there's a great chance that it could. But the only way we really know is if a patient were to come in, do a consultation, do an exam, take some x-rays, then we would be able to go over with them if we're going to be able to help them in the realistic type of correction we may want to achieve, or we could go over with them that we may not be able to help them. And so it's always a safe alternative because the surgical approach to scoliosis is they cut you open and they take these rods, they're called Harrington rods, and they screw them to your spine and they try to implant these rods in your spine, trying to keep it from getting worse over time. Now, scoliosis in kids can be very dangerous. And the reason for this is if a kiddo has this abnormal curve, and let's say they have not gone through puberty yet, over those next few years going through puberty, they're going to grow at a very fast rate. And as they grow, that scoliosis gets worse. So it's very important that if a kid does have an abnormal curve, or if you just want to get them checked to make sure they don't have scoliosis or abnormal curve, that's always a good idea. But it's important that they start to get adjusted and start to correct that. And that way we can work on fixing it over time instead of it just drastically getting worse over time. So my name is Dr. Jason Raesz with Advanced Chiropractic. And I want to encourage you to have your kids checked. I also want to encourage you that if you have a friend or a family member that you can tell that they're just kind of abnormally curved, or they have this abnormal posture, or maybe they've told you they're diagnosed with scoliosis, invite them to our next Dynamic Wellness Dinner. The next dinner is at Cotton Patch Cafe, and at the dinner I buy everybody dinner. Dinner's totally on me, which is a huge plus. But we're going to talk about chiropractic care, we're going to talk about health, we're going to talk about wellness, and then we even have a special offer at the end if somebody wants to come in, get the exam, get the x-rays done to find out if there's a chance we can help them. If they don't want to go to the dinner, they're always more than welcome to call in. Our number is 254-778-2225. Thank you. I hope you found this segment informative, and I hope you have a fantastic day.